Okay, the reason I have this slide like this is clinical alert. You ever, if you don't learn anything in this class, learn this. There have been many nurses that have killed patients that have pushed potassium. It acts directly on the heart muscle. It always has to be diluted. You're never ever going to push potassium IV. It basically is the perfect murder. And then, of course, I'm being sarcastic here, or maybe not so perfect. This basically, folks, is what we give on Skid Row. Not Skid Row, I'm sorry, on death row. Death row. When people are put to death as a prisoner, they give them potassium because it just stops the heart. So you always have to dilute it. You're never going to give more than 10 MEQs per hour. And again, it will directly, remember how in the previous slides, we talked about how it can affect the heart their muscles, period. Well, it renders the heart muscle paralyzed and it will cause instant death. All right, so I just wanted to make sure I made that point when I finished that other video. So, oh, also I forgot that it burns at the IV site. Again, to dilute it, people won't let you put it in fast because it just hurts. It's a chemical, so you need to give it very slowly. Okay, now we're going to talk about calcium. So calcium, too much calcium. Causes can be malignancies. And what are the symptoms? Very lethargic, sometimes through fractures. We're losing calcium through the bone. Treatment, diuretics, and then diet low in calcium. Increased thyroid can cause too much calcium. And why would that be? What's on the either side of the thyroid? The parathyroids. And what are they responsible for? They're responsible for calcium metabolism in the body. So sometimes if we have an increased thyroid, we have an increased parathyroid. Not all the time, but sometimes. TB, prolonged immobilization, they can have too much calcium in the blood, excessive vitamin D intake, and then a kidney transplant. Hypocalcemia, what would that be? Surgical removal of the thyroid. If we're taking out the parathyroids, I just told you that they regulate calcium metabolism. If we have an underactive parathyroid, a deficiency of calcium in the diet, decreased levels of vitamin D, magnesium levels are down. We have manifestation can be a Chopstick sign or a Trousseau sign. And what are those? Chopstick sign is when the cheek is tapped on your face. You just tap your cheek and it can spasm. That can be a sign of hypocalcemia, and I'm sure it was named after him. And then Trousseau sign is when you're taking a blood pressure, the wrist spasms. So you're not really so much interested in what you're doing with the blood pressure, but the wrist will spasm. And then tetany, what is that? That's when the muscles are just stiff and tetanic, just stiff. We can have because of lack of calcium. Management of we're just going to give them calcium gluconate or a diet high in calcium and vitamin D. Calcium's relationship with potassium, when one goes up, the other one goes down. So calcium and potassium are inverse to each other. Just remember, when potassium goes up, calcium goes down. Calcium, we know, is necessary ion for the structure of bones and teeth. It's necessary for blood clotting, in hormone secretion, and in the function of cell receptors and in membrane stability. Calcium and phosphate are rigidly controlled by the parathyroid hormone, vitamin D, and calcitonin. Calcium is one of the most important minerals in your body. It's essential for the proper functioning of muscles, nerves, and the heart, and is required again in blood clotting and formation of bones. About 99% of calcium is found in the bone. The other 1% circulates in the blood. Okay, let's look at chlorides. Normal chloride is from 96 to 106. The chloride ion is formed when the element of chlorine picks up one electron to form an anion. Now we're talking about the negatively charged molecules. The salts of hydrochloric acid contain chloride ions and can also be called chlorides. And examples: table salt or sodium chloride, or sodium chloride. Chloride ions have important physiological roles. Within the central nervous system, it's the inhibitory action of glycine. Some of the action of the GABA, which is the amino acid gamma aminobutyric acid, relies on the entry of chloride, the negative anion, into specific neurons. It's usually taken into the body through food and table salt, works with other electrolytes to maintain the fluid in the body and maintain the acid-base balance, or pH. Chloride is present in all body fluids. Increased concentration in the blood and fluid outside of the body's cell. Most of the time, the chloride concentrations mirror sodium. So chloride ions mirror our sodium. If they're up or down, usually for the same reasons of sodium. When there's an acid-base balance, blood chloride levels can change independently of sodium, as chloride will act as a buffer. It helps to maintain neutrality at the cellular level by moving into or out of the cells as necessary. So hyperchloremia, we said the normal was 96 to 106. Usually they're all about 10 in between each other, except for potassium. It's got a very small margin. That was the one, but 3.5 to 5.5. Usually hyperchloremia indicates dehydration, causes certain drugs, and you can see our carbonic anhydrase inhibitors to treat glaucoma. Dehydration, again, metabolic acidosis, respiratory alkalosis, renal tubular acidosis, and too much bromide occurs when there is too much blood sodium. Remember how they said they mirror each other. So if we have too much sodium, we probably have too much chloride. It's caused by an excess of sodium or a deficit of bicarb. Hypochloremia, again, we've got that less than 96, too much is 106. Abnormally low amount of chlorine in the blood. Addison's disease, burns, kidney disorders. You can read these. Usually it's the result of hyponatremia or elevated bicarb concentration. So not enough sodium. Again, it's not enough chloride. It mimics sodium, or elevated bicarb concentration. Develops as a result of vomiting and the loss of hydrochloric acid. Occurs in cystic fibrosis. Alters acid-base balance. And you can see with a lot of this, that's gastric suction, metabolic alkalosis, overhydration. All of this is going to affect our acid-base balance. Chronic compensated respiratory acidosis, so that would be our obstructive diseases. If they're chronic, but they're compensated, we may have a low chlorine level. Excessive sweating due to losses of sodium chloride. Again, it's going to mirror sodium. Magnesium. We need to talk about magnesium. Magnesium is known as the stabilizer. It controls the electricity at the cell membrane, slows down that sodium-potassium pump. Calcium absorption helps with blood clotting, can affect the parathyroid secretion and intracellular calcium. Too much magnesium, pulse, blood pressure, and respirations can be slowed to dangerous levels. When I say it's known as the stabilizer, it calms the electricity at the cell membrane in the brain, central nervous system. And when you're calming the brain down, everything else slows. Use mag sulfate drip to slow the rate and intensity of uterine contractions in labor patients. It's used in heart irritability to slow dysrhythmias because it's affecting the heart muscle. And we basically, when in OB, when we give it to the mom to slow down the contractions and it lowers their blood pressure, it stops them from having seizures because it's slowing down the brain. If we don't slow it down enough, they can have a seizure. However, with not enough mag sulfate or too much mag sulfate, they can have a seizure. What was I going to say? I can't remember. It'll come to me. And again, using heart irritability to slow dysrhythmias. A little is good, a lot is not. Oh, that's what I was going to say. In OB, they're 1-to-1s because when we give it through the IV, we can wipe their respiratory tract out. Again, too much pulse, blood pressure, respirations can be slowed, or we can send them into a respiratory arrest. So very, very, very important electrolyte, but it can also, we see it slows the sodium and potassium pump. And when we mess around with sodium too much, we can have a seizure. We mess around with potassium too much, we can have a heart attack, and we can have a respiratory arrest. So again, a little of this is good, a lot is not. A lot can make the blood pressure bottom out. It needs a respirations. We can wipe them out. They can go into a respiratory arrest. Hypermagnesium would be greater than 2.5. Causes renal failure. Whenever the kidneys are in trouble, all your electrolytes are going to be off. Uncontrolled diabetes, antacids. What's it going to look like? Bradycardia, blood pressure's down, respirations are down. Management, clinical alert. We'll give 10 MEQs per liter. And again, this can cause respiratory arrest. So we have to give it very slowly. We're going to monitor the blood pressure, pulse, EKG, respiratory rate, and patient needs to be on a pulse oximeter. Whenever we're giving this is so fragile in the bloodstream, magnesium, that we need to know what the antidote for it is. And the antidote is calcium gluconate. We have to know where this is if we're giving mag sulfate, because if we're all of a sudden bottoming out the pulse, blood pressure, and especially the respiratory rate, they're going to go into a respiratory arrest and they could possibly die. So we have to know that if we give calcium gluconate will slow it down and stop the reaction. It is the antidote. And this is hypermagnesium. We've given too much. Now we're going to go to hypomagnesium, and it's another one that's more of a narrow margin, 1.5 to 2.5, more like potassium that way. And not enough magnesium, a prolonged diuretic, the drug garamycin, so there you go, and any chemo administration can wipe out the magnesium. Manifestations: coenzyme and carbohydrate and protein metabolism, hyperexcitability, insomnia, muscle twitching, and tetany. Management: we don't have enough. We're going to give it either orally, IM, or IV, and we're going to monitor that blood pressure, pulse, and respirations, because we know that it can cause it to go crazy high, as the hyper one can wipe it out. Okay, we will start up with hypophosphate at the next video.